Mr. President, my colleagues have been out here in the last few minutes, last night, this morning, this afternoon, to talk about our distress of people trying to push again the repeal of the Affordable Care Act without a successful strategy to move our nation forward on more affordability. We just received a letter from 10 governors basically telling us the same thing, to slow down and work on a bipartisan basis, basically telling us that the proposal that people are trying to rush through without regular order is not the kind of thing that is going to help us in making the reforms that are necessary. So I think that these bipartisan governors, from the governor of Colorado to the governor of Ohio to the governor of Alaska, the spectrum of Democrats, Republican, and independents, is something that people in the United States of America should listen to, because it's important that we get this right, because the affordability of health care is so important. What I don't like about the proposal that is now being pushed by my colleagues, even though they want the states to have some flexibility and play a larger role, is that it basically ends the 52-year state-federal partnership that we know as Medicaid today. That is, that it changes the dynamic in saying that the state and federal government are in business together to take care of a population that is the most vulnerable of citizens in our country, and that giving them affordable access to health care is a priority because it actually reduces everybody's health care costs. When people think about the expense in health care, you can ask any provider, they will tell you that $1 in $5 being spent on the federal system drives the cost of everybody's insurance. So if you leave people uninsured, they go to the hospital, they raise the cost of everybody, it's not a good strategy. We have seen states that have covered people on Medicaid actually raise people out of poverty and help their economies and reduce the costs at individual hospitals, thereby driving down the cost of private insurance. So why would we want to destroy that by authorizing in legislation the end of this 52-year relationship between the federal government and states on trying to make sure that our populations are covered, that if a state spends a dollar, they can count on the federal government to spend that dollar as well, and to continue the partnership that works cost effectively. What I also don't like is that it sunsets Medicaid for 15 million people. Sunsetting Medicaid, if you're going to sunset this 15 million people, when are you going to sunset Medicaid for the rest of the Medicaid population? When are you going to try, by legislative action, to curtail the opportunities for millions of Americans who use Medicaid as a stabilizing force for health insurance in America? In our state, 600,000 people, most of whom were previously uninsured, would then be set for that sunset of Medicaid. The legislation that my colleagues are pushing basically would end the funding for this program in 2027. So that would leave states with an unfunded bill for those individuals of over more than $300 billion. So I doubt that states have the money. I doubt that the individual market is going to take care of those individuals as cost effectively as we're taking care of them. And states will then cost shift these resources back to the cost of the public and raising everybody's rates again. Our job here has to be about affordability. It has to be about driving down cost. It has to be about driving down cost in the individual market and driving down cost of the delivery system overall. But there is nothing innovative about kicking 15 million people off of Medicaid and sunsetting it in this bill. I also object to the notion that my colleagues are literally advocating privatization of Medicaid. They're advocating that what you do with this population is take them off of the current program and shift them onto the exchange. Now, some people who are following this might say, well, wait, then they could go to the private market, and yes, there's support to make sure that we have affordable health insurance. No, because the legislation also says that you stop that support by 2027. So this is just one more sneak attack by our colleagues at kicking people off of Medicaid. To start the process and agree to privatize Medicaid, where is it going to end? Now, I'm the first to say that we can improve our delivery system, that we can save money. I've advocated one, I think, of the most cost-effective ideas of the Affordable Care Act, that is to move the population of our citizens who need care in the later years of their life off of nursing home care and into community-based care. It's 1/3 the cost. Our state, the state of Washington, saved $2 billion doing this over a 10-year period of time. If other states would do this, we could save $100 billion or more by having states give people the opportunity to age at home and have a long-term care delivery system that works in our communities. It is 1/3 the cost. Now that is innovation. That is cost savings. That is improvement on our current delivery system and hopefully covering an aging baby boomer population that is going to reach retirement and a population of Americans that are going to live longer. But there is nothing innovative about just privatizing Social Security, privatizing Medicaid, and kicking people off by shifting them over to an exchange and then cutting the resources for the exchange. So I hope our colleagues will stop the notion that somehow that this is innovation. It's not innovation, it's sunsetting, it's privatization, it's cutting people off of care, and that is why we have heard from these governors and others about why this is so important not to take this bait. We need to make sure that we're continuing our bipartisan discussions, continuing to work together about what will drive affordability into the market. Bundling up a population and giving them clout to negotiate on rates and giving a state the ability to negotiate on rates, either on drug costs or on insurance, yes, can save dollars. It's being done right now in New York and in Minnesota, and it can be done in other places. But cost shifting to the states of this $300 billion, or then making states make the draconian decision of, wait, I already shifted that population onto the exchange. Oh my gosh, the federal government just cut the funds that we're going to get. Next thing you know, this population is left without care. Privatizing Medicaid is not the way to go. I hope our colleagues will continue to discuss on a bipartisan basis the aspects of the Affordable Care Act that could be expanded to drive down cost and increase affordability. I hope that they will continue to make sure that things like basic health, the essential elements of what should be covered in a basic plan, are there for our consumers, that somehow we're not going to take the bait in thinking that by cutting essential services to people, that somehow that is the way to get a private insurance plan. We have the ability to work together. My colleagues and I have been working and discussing these ideas. My colleagues, Senator Murray and Senator Alexander, are working on various ideas in their HELP committee, as well as the Finance Committee, in making sure that we expand and fund the affordability of insurance for children and their families under the CHIP program. But let's not make this worse. Let us not end this 52-year relationship that has successfully covered a population of Americans, and let's not fall for the bait and think that somehow this is going to save the American taxpayer money. It is not. It is going to cost shift right back to the private individual, raise individual rates, and we can't afford it. Let's not privatize Medicaid. Let's fight to make it a more cost-effective program for the future. I thank the President, and I yield the floor.